It's more important than ever for defense team members and their families to receive their annual flu shot this year in light of the COVID-19 pandemic. Today, Major General Marc Bilodeau, Surgeon General for the Canadian Armed Forces, joins me to speak more on the benefits of the flu vaccine. Thank you very much for joining us, sir. Why is it so important that defense team members and their families receive the seasonal flu vaccine?
With the flu season fast approaching, there is a growing concern among health professionals of a twindemic. A twindemic would be an overlap of the flu season and a second wave of COVID-19 cases this fall and winter. In light of COVID-19 precautions, any respiratory infection, such as the flu or common cold, could lead to you or your family having to stay home from work, school, and public spaces. Also, if someone with COVID-19 gets the flu, they could have worse symptoms like coughing and sneezing that makes them more likely to spread the infection. Not only will the flu shot help to keep you and your family members healthy, it will reduce burden on our healthcare systems by helping to ensure hospitals are not trying to care for the flu and COVID-19 patients at the same time. Finally, by reducing the amount of respiratory viruses in circulation, it will reduce the requirement for using limited testing capability to rule out COVID-19 infections.
When and where can defense team members and their families get their annual flu shot?
Regular Force Canadian Armed Forces members can attend the flu shot clinic through their Canadian Forces Health Services Center. Please rest assured that clinics will adhere to COVID-19 public health measures when administering the flu vaccine. More information about the flu shot clinics will follow in the upcoming weeks. Class A and Class B reservists on short-term contract and their families can access the flu vaccine through their provincial healthcare systems. Civilian employees can get a flu shot through their healthcare providers, a local clinic, or at a pharmacy. The department is also exploring offering the flu vaccine for civilian employees at bases and wings around the country. In the event that the flu vaccine is not offered free of charge, the expense can be claimed under the Public Service Healthcare Plan.
How can defense team members and their families safely get the flu shot while avoiding large gatherings of people?
Flu shot clinics, whether through Canadian Forces Health Services centers or through provincial healthcare systems, will be delivered in line with COVID-19 public health measures. This will include not allowing anyone who is sick to receive the vaccine, ensuring physical distancing is respected, avoiding large crowds at our clinics, asking people to wear a mask and stay 2 meters apart, and obviously hand washing at the arrival and departure of the clinic.
In addition to getting the vaccine, what other health measures should be taken during flu season this year?
It's important to remember that in addition to getting the annual flu shot, other public health measures are equally as important to fight the spread of influenza, the flu, and COVID-19. This includes maintaining a 2-meter physical distance from each other, wearing a mask when out in public, frequently washing your hands, and practicing cough and sneeze etiquette. Lastly, if you're sick, it's important to stay home, avoid infecting others, and call your healthcare providers to determine if you should be tested.
Is there anything else you would like to add?
I'd like to thank all members of the defense team for everything they're doing in the fight against COVID-19 and ask them to once again apply the same vigilance and dedication when it comes to this flu season by getting their flu shot.
Thank you very much for joining us today, Major General Bilodeau.